All right, whenever you're ready.
So, how many of you know what Russian roulette is? Just for those who don't know, I'll give a free refresher course. And as the name implies, it is a game of chance that originated in Russia, where you place one bullet of ammunition into a revolver, spin the chamber, and if you're lucky that day, when you put it to your head and pull the trigger, you just hear a relieving click. If you're not so lucky, well, you won't hear it, but the people around you will. They'll hear a nice big bang. Now you're probably wondering why on earth I would be telling you something like this. Well, whether you all know it or not, you are all currently playing a round of Russian roulette with breast cancer right now. And gentlemen, it's not just the ladies. You're at risk too, though at a lesser percentage. And more or less for my 18th birthday, my mom lost her game. And I had to witness as she went on her journey to recovery, and I still witness today the after effects of her treatment. And according to the American Cancer Society, and their estimations for this year of 2011, they estimate that 230,480 new cases will be diagnosed this year. And of those, 39,520 will prove to be fatal. Most people have a general idea of what cancer is, but when you ask them questions about it, not many people will be able to answer specifics on it. So today, to further our understanding of breast cancer, we will be covering what it is, how it's treated with current technology, and what happens in the aftermath after treatment. So let's dive in. We'll get a nice refresher on what breast cancer is, and pay attention because I might just throw in a quiz at the end for kicks. So, what is breast cancer? According to the Pocket Guide to Breast Cancer by Dr. Karen Dow, who is a member of the American Society of Clinical Oncology, it is a genetic disease which involves deviations in normal genetic mechanisms of growth, function, and death. And there are four to five different stages if you include stage 0. And M. Sarah Rosenthal, who is a bioethicist and expert on women's health ethics, says that there are 4 to 5, as I said, if you include stage 0. And the survival rates through the stages are begin with a relieving 93% and dwindle all the way down to an alarming 15%. And those are numbers you don't want to have on your table. Through the stages, it is a tumor that grows in the breast, and in the first stages it's just enlarging, and when it gets to stage 4, it has spread to other tissues in the body, and that's when the trouble really begins. So now we have a basic understanding of what it is, but that begs the question, how do we cure it? Well, the first thing to do is differentiate between the 2 main types of treatment, and that is local versus systemic. Local treatment doesn't affect the rest of the body, and it's methods like surgery and radiation therapy. And then there is systemic, which uses drugs and chemicals to specifically target the cancerous cells in the body. And examples of that are chemotherapy, hormone therapy, and targeted therapy. Now that we know the basic 2 types of treatment, we will investigate one of each to give ourselves a better understanding of how they work. The types for local, the most common is a mastectomy, which is either a part or full removal of the breast in order to get rid of the cancerous cells. And Rachel Airley, who wrote a book on chemotherapy specifically and is a cancer research scientist and lecturer, she writes in her book that it's a use of chemicals to slow down or entirely stop the growth of cancerous cells. And just as an addendum, most cases of breast cancer need both types of treatment. And that is in order to, first of all, remove the cancerous cells from the body, but then they also generally need the second type in order to minimize the chances of reoccurrence. Okay, so now that we've cured your cancer, what happens after? There are a multitude of side effects that occur from the various types of treatment, and while they are better than death, some of them are very life-changing and will change the daily habits of the recovered patient. And so I feel that I'll begin with my mother. From her chemotherapy and radiation, she developed what is called peripheral neuropathy. Now, neuropathy is the deadening of nerves, but not completely, so they still feel pain, and they constantly provide that sensation. And the peripheral part just indicates that it's in her extremities, so her hands and feet. They always pain her, and if she doesn't take her medication, she wouldn't be able to do anything. She would be the equivalent of a vegetable. Now, other side effects, according to the Breast Cancer Sourcebook, there is anemia, which creates less red blood cells in your blood, which leads to chronic fatigue, and a lot of the times, if they overexert themselves, they'll have to lay down for a while. There is also fatigue by itself, hair loss, as that happens with most people, and we've all probably seen a couple of breast cancer patients where they have their either wig or their nice little knit caps. And breast cancer is a very trying time, even after it's been cured. So there are online support sites for these people, and one of the prominent ones is the Breast Cancer Support site. And it's an online support site where patients who have just been diagnosed and recovered patients are able to discuss their fears and their accomplishments and their success stories. So we know about what it is, how it's treated, and we've taken a small glimpse into what happens in the aftermath. Cancer, breast cancer, is a very serious thing, and I hope that I have illustrated for you today just how so that is. Knowing is half the battle, as the saying goes. So I encourage you to remember what you've learned about it, how it's treated, and if you know someone who's a breast cancer survivor, please take the time out of your day to congratulate them on their success. Further advances, for those who are interested in helping advance it, there are many foundations out there, and one of the most prominent that most people have heard of is the Susan G. Komen Race for the Cure, and that is a fundraiser that over the course of 3 days, participants walk 60 miles. And this has, in recent years, become larger and larger and larger, and it's a great way to help provide funding for more research. And to conclude with, always remember, life is precious. Most people know this saying, but not everyone understands the full meaning behind it. I thank the Lord every day that I still have my mother, because 15 years ago, she would not have survived from the technology at that time. So, always remember, the small things in life are truly important. Thank you.
Take some questions, Stephen.
Questions?
Where's our quiz?
I just said it was for kicks, and I didn't really decide to throw it in because you were all such an attentive audience.
It was an idle threat.
Professor Wang.
Thank you. Okay, so I wanted to ask about, you know, obviously in addition to the physical effects, going through cancer and treatment and everything.
Mental?
Right, is a very kind of mentally difficult experience. So I was wondering, in terms of actual psychiatric and, you know, psychological conditions, can this experience actually cause mental conditions to occur?
Yes.
Mm-hmm.
And I don't like discussing it, but they, basically the best way I can describe it as with my mother, her brain has a lifespan each day. And if she doesn't take a nap sometime during the day and essentially reset her timer, by the end of the day she cannot form a coherent sentence. And having a discussion with her is nigh impossible. So she can still write, but an actual verbal discussion, you're not going to have one.
And that's from chemotherapy, you think?
That she describes it as chemo brain. So it is the side effect because my mother's very intelligent, has a very sharp mind, and being in the house through this process, I was able to see the change that occurred. So chemotherapy and radiation therapy forgot the word I was looking for, but in combination, do produce mental side effects that are not limited to depression and suicidal thoughts, and there's a wide spectrum of what can arise from the aftermath. But in the scheme of things, it's better than death.
Thank you.
In your research, did it give percentages between men at risk and women at risk?
It is significantly less common in men, but it is just as serious when it does affect men. The percentages is, I didn't find an exact one for men, but for women, overall, if you lump all ages together, the chances of a woman developing breast cancer is 1 in, I can't remember how many exactly, but it was 12%. And 12% is not a good number for something this serious. Because other things that are this serious, like tuberculosis or you name your serious illness, the chances of that are usually less than 1%. And the older a woman becomes, the likelier it is for the breast cancer to metastasize. And like in my research, like 50 and older, it was much more prominent. In the age group of 30 to 35, it was substantially lower because it's less common that young. But the younger it affects them, the worse it is. I couldn't find a exact reason behind that, but historically, the younger a person is when they develop any type of cancer, it is more serious if they're younger.
Huh. Okay.